Okay, I am still grooving to that new theme music. Thank you so much, my Be Health Empowered family, for joining us once again on Excuse Me, Doctor. My name is Dr. Melissa Clark. Everybody calls me Dr. Mel. I am so excited to be here with you again this week and grooving to that new theme music. I hope everybody liked it. And, we're here every week making sure that you have the information that you need to make wise, informed health decisions, not just for yourself, but for your family as well as your community. So, thank you for joining us on any platform that you're listening to us on, whether it's blackdoctor.org, whether it's Dr. Melissa Clark, whether you're on Facebook, whether you're on YouTube, whether you're on SiriusXM. HUR Voices 141. We are excited that you are just tuning in. And if you are newbies to any of these platforms, if you're on Facebook, please hit that like button. Really appreciate you for it. And if you are on YouTube, please go down and hit that red subscribe button. Um, you know, it would be great if you did that. Really, really appreciate you. And then, most importantly, if you're listening, please be a part of the conversation and put those questions and comments that you have in the chat, because we are going to get to them first come, first serve basis. So, please contribute to the conversation and join in. And of course, to make that happen, to bring your word from the street and read what you're talking about in the audience and just be a part of the conversation, I have to have my two wonderful co-hosts, Miss Bria Good and Mr. Wayne Bruce. How y'all doing?
Doing
Howdy.
good.
Howdy, howdy, howdy.
You always come here saying howdy like you from Texas. You from DC.
Texas. I'm from Georgia, actually.
Georgia Avenue. Yeah,
Georgia Avenue.
In DC.
Georgia Avenue.
In DC. Right.
As you can see, my background is of DC. It is of DC.
Right. And for those people who are just listening and not watching, what is your background?
My background is a bridge. It's the bridge in DC. I don't want to get into it
is it the
because
Bay
people
Bridge?
can't
Is
see
it the
it.
Golden Gate Bridge?
People can't
Is it
see the
Lake
bridge.
Pontchartrain Bridge?
The Memorial Bridge.
Is it
It's the
Anacostia
Memorial
Bridge? Like,
Right.
It's the Memorial Bridge. It
In
leads
DC.
from Virginia to Washington D.C. And if they're listening and not looking, yeah, I have a picture behind me of the Memorial Bridge. It is it's a landmark.
Right.
Yeah.
And it's symbolic because you're bridging the comments and the feelings of the audience and bridging them in. Is that too much? It's too much. Okay.
Yeah, that's too much. We behind schedule right now, Dr. Mel.
All right. So what are we talking about today? What's the show?
Dr.
We talk
Mel,
about
for years, man, people talk about and especially in our community and communities of color, we've had a problem raging with our blood pressure.
Yes. Absolutely. And so we're going to be talking about life hacks to manage our blood pressure. And just like you said, 55% of African Americans have high blood pressure. That's more than 1 in 2
Wow.
Black people. We actually have the highest prevalence of high blood pressure, Black people in the United States do, among any ethnic group in the world.
Wow.
Just let's
surprising.
sit with that. Yes. And then even for Americans in general, it's 46% of all adults. So still high. So the chances are, if you're listening to this show, this may apply to you. It's a 1 in 2 chance this applies to you, and probably even higher that it applies to somebody who you know. So please share right now. Share this episode with everybody you know so that they can tune in and listen to.
It's important,
please
y'all.
share it. So let's get into what we do every week, which is recap what happened in the world of health and wellness this week.
Yes.
Right. The health and wellness highlights our weekly recap.
Yeah, Dr. Mel.
So what you got?
I like to start it, Dr. Mel, just because I'm about to go. We have some graduations coming up and some events where we'll be around a lot of people. And actually, I was just at an event with a lot of people. And so
Right.
COVID still scares me. So, I got to ask, is it time to get another booster?
Well, it depends on who you are, right? So the WHO, the
Mhm.
WHO, just came out with recommendations that are updated, and they updated it because so many people have, worldwide have immunity either from prior vaccination or from infection. So they felt like, okay, we need to revisit this booster issue. So they recommend that healthy children and adolescents might not necessarily need boosters. Okay. But adults over 60 and those of any age with any kind of underlying chronic health issue should get a booster 6 to 12 months after their last vaccination. Right. And I said any age, but really above 6 months old.
Okay.
So,
Mhm.
yeah, go ahead.
So that means when we say underlying conditions, name the most prevalent ones, Dr.
Yeah,
Bell.
so high blood pressure, like we're talking about tonight, heart disease, asthma, autoimmune diseases like sarcoid and lupus, heart failure, being actively treated for cancer, all those, COPD, diabetes, obesity, all those are underlying chronic health conditions that would warrant um, getting a booster, because when your body is engaged in dealing with a chronic disease, you don't have the resources to mount a vigorous immune response. And so that's
Mhm.
why it's helpful to get a booster to basically like tune up and tweak your system and make you ready in case you run into COVID again.
Okay.
That sounds like all of America.
Right,
Pretty
right.
much.
Right,
Yeah.
exactly.
Yeah. Yeah. And so, just to be clear, the vaccinations and boosters are safe for all ages, but the WHO is an international organization. So, they also have to consider from a resource perspective, especially those countries that don't have as many resources to boost their whole population. So, they felt, again, it was necessary if you're trying to figure out from a resource perspective, where's the best bang for your buck, you don't need to boost healthy children and adolescents.
Got
They
it.
still
Gotcha.
need their primary vaccines, though.
Yeah,
Got
don't
it.
forget those.
Yeah.
So, we're always trying to figure out ways to help those who face dementia and Alzheimer's and some of those things that aren't easily cured by medications, right? So
Mhm.
now we're talking about green spaces. What's the thing with
Yeah.
green spaces helping to lower dementia risk?
Absolutely. Green spaces, meaning like parks and community gardens. There was a new study that finds in middle-aged women, they actually looked at a big cohort of nurses. They found that access to those kinds of green spaces was linked to a lower risk of dementia. And the thought is that nature basically helps people recover from psychological stress and depression, which are two big risk factors for dementia. And now, this is the thing. We know that as African Americans, we have more stressors due to racism and discrimination in everyday life. Um, and and in addition, we are twice as likely as whites to develop dementia.
Mhm.
So I want to leave you with three things about this. The first is that this study included mainly white women. So it needs to be repeated and expanded to other ethnic groups.
Mhm.
Um, and number two, in the meantime, start going for nature walks because that will improve your mental well-being and possibly decrease your dementia risk. And three, make sure that you lobby for more green spaces wherever you live. Remember, we talk about how to empower yourself, your family, and your community. That is one way, especially if you live in an urban area. Lobby for green spaces in your community because they're not evenly distributed.
Exactly.
Mm-mm. They are not. People be talking about the concrete jungle. They don't be having anything.
Exactly. You got it.
So, to kind of move forward with the show, we have a very important date coming up for those who are on Medicaid, and it's kind of bad, actually, right?
Well, sort of, yeah. So the date was April 1st, right? So it actually has passed now, but it has to do with Medicaid. Medicaid is that insurance program from the federal government that helps people with lower income have health insurance. And during the COVID it's managed by the states. But during the COVID public health emergency, part of that emergency was so that people could stay on Medicaid throughout the emergency, which meant that they had access to health care when they needed it. So even if your income increased so that you no longer qualified, you could still stay on Medicaid. Well, those days are over. As of April 1st, they're going to be doing redeterminations, looking at your income again and whether you qualify. So basically, you should look for a packet in the mail or listen out for a phone call from Medicaid with your renewal package in case you are eligible to renew. Fill that out. Make sure you do that. Or you might also be getting a letter explaining where you can purchase affordable health insurance if you no longer qualify. So, for example, on the open marketplace, the Obamacare marketplace.
So basically, Dr. Mel, we had universal health care during the pandemic, right?
Essentially, yeah. We basically did, because everybody who could be on Medicaid was on Medicaid. And then you also had commercial insurance and you have the marketplace option. So yeah.
Oh, wow. That's good to know. So that brings us to another thing. That brings us to the past couple of weeks we've been talking off and on about different things about losing weight because, basically dropped 30 pounds. And I don't want that to go over lightly.
Okay. Everybody stop. We need the applause,
I
that
mean,
Wayne has lost 30 pounds. I mean, sincerely, that is absolutely wonderful. But let one of us toot your horn. We tooting your horn.
I didn't want to bring in all that. I didn't want to. I mean, or I could have done that.
Okay.
It just has to be your show. It just gotta be your show, don't it?
Actually, it doesn't. But I want to speak to the people who are using the diabetes drugs like Ozempic. We talked about that last week, and Wegovy. I think it's called Wegovy.
Yep.
For weight loss,
Yeah.
and they're having some problems once they stop taking the meds.
Right. So just so you know, everybody knows, Ozempic and Wegovy are two medications that are sort of like hot right now because they're associated with weight loss. Wegovy is approved for that use, but Ozempic is really a type 2 diabetes medicine. And people, we talked about last week how it's so popular that type 2 diabetics can't even get it because everybody's using it off label for weight loss. But what some people might not realize is that these pills are not a quick fix. It's not like you pop a few and then you can come off of it a few weeks later after you can, have your bikini body again. What you need to know is that once you stop them, if you continue the, whatever you were doing before in terms of your eating or lack of exercise, whatever the situation was, the weight's going to come right back with a quickness. So that's important to understand.
Okay. Look, y'all just need to eat right and be in the gym because all these quick fixes is not going to keep the maintenance. You still have to do maintenance.
You still have
exactly. And obesity is a chronic disease.
It is a chronic disease. I've suffered from it. I mean, we need to do a show on another show on obesity.
We're working on it. We're working on
really
it.
A show on me. But I'm just kidding, everybody. Just kidding. I know what you're thinking. I'm just kidding. But no, just, the fact that, I mean, this is something I've struggled with since I can remember,
Yeah.
And when you're early in your early years, like Bria, you could yo-yo diet and get away with it.
Hold on now.
but you can't in your later years. Like I have some snow on the side here. On my chin, I fell in a snow pile. It just happened to land on my chin.
And it stuck.
Just stuck. And so it's really, really tough. It's really, really tough when you get
there. So it's not easy.
It's not
easy. So and it's it has to do with sleep. It has to do with how you manage stress. It has to do with like you said, movement and exercise. and obviously nutrition. So it's multi.
Mhm.
It's a bunch. We're gonna just do a whole show on it. So we're
All
gonna
right.
get to
Let's
that.
just do a show. You can put
All
a pin
right.
in that.
So now that we gonna do that, you know what time it is, don't you, Dr. Bell?
What time is it?
Time for the
Weekly debunk. Stopping misinformation in its tracks.
So I'm sick of this Twitter fingers family because as soon as you started talking about the booster, this is why I put my phone on Do Not Disturb. Twilight to the Twitter fingers hit me up and said, I heard Dr. Mel talking about those boosters, right? So I'm glad to hear that I don't have to take one just because I'm pregnant. Please, can you talk a little bit about that, Dr. Mel? Because we need to put this Twitter finger family into place at this point.
Yeah. Well, you know what? I'm not mad. I'm not mad at her because she reminded me that I specifically needed to call out pregnant women, right? Because that is one special population that boosting is crucial for. Because we know that pregnancy is a risk factor for getting COVID-19. And the United States already has a terrible record with maternal death, right?
Mhm.
Which only skyrocketed during the pandemic. It's went up by, I think, 56%.
Oh, wow.
Moms dying between 2019 and 2021, all due, mainly due to pandemic. So the question about boosting protects mothers during a very risky time, meaning when they're pregnant, and it's crucial in preventing hospitalization and death among pregnant women. So the booster should be given to pregnant women even if they've already had a booster, if it's been more than 6 months since their last dose. And if you give it in the third trimester, of the pregnancy, you get a little added benefit, and which is that the infant, when they're born, has COVID antibodies that got passed from their mom because their mom got boosted. And in that first 6 months, you can't get vaccination, so you don't have any antibodies. So it's a very vulnerable time for infants. There's actually more hospitalization of infants than there are for the 50 to 64 age group now, right?
Mm.
So that's why, boosting for pregnant women is very important. So thank
No.
you, Miss Twitter Fingers, for reminding us to mention that.
My phone going back on Do Not Disturb.
Do Not Disturb. There it is.
Well, on that note, thank you all for walking us through the recap and the debug. We are going to move on and see y'all in a little bit because we are going to be talking about blood pressure. So many of us have or may have in the future that diagnosis. If we're over 60, 70% of people in the United States over 60 have a diagnosis of high blood pressure. So what can we do about it? How do we live our lives to avoid all the things that go along with that diagnosis too? Avoiding heart attacks, strokes, and kidney failure, which are all byproducts of sustained, uncontrolled high blood pressure. So we have two incredible guests that are going to walk us through this topic about managing your blood pressure. We have Dr. Sidney Nelson, who this is his second time on Excuse Me Doctor. He is officially a friend of the show. He's a board certified internal medicine physician who prides himself in taking a holistic approach with his patients. He's also known as the Around the Way Doc because he's committed to making sure that care is accessible for all, especially those in the Black and Brown communities. So thank you, Dr. Nelson, for being with us. And we also have Miss Raisa Martinez. She is a certified transcendental meditation teacher who's taught over 800 people. And she's also the director of the Meditation Center in the underserved Ward 8 area of Washington, D.C. She was at the David Lynch Foundation in New York City prior to this. She's worked with the Manhattan Family Justice Center, the Center for Health and Wellness, and the Bronx VA. So thank you so much for joining us, Raisa. All right. Well, let's kick it off. So, Dr. Nelson, let's just assume people don't know anything about blood pressure, right? What is blood pressure and why is it important?
So I think the very simple way to look at blood pressure is this. Think of your heart as a pump, right? And so what blood pressure is doing is monitoring that flow of blood through your body in relation to that pump. And I think of your blood vessels like a hose. So you have a pump and you have a hose. So we want to know what the pressure is going through that hose, and that's your blood pressure. So the top number, which is called the systolic, and so our blood pressure it's when you go to your doctor, you'll see two numbers, a top number and a bottom number.
Right,
The
like
top,
120/80, right?
which is the perfect blood pressure, correct? So
Yep.
that number right there, that top number, 120, is your systolic blood pressure. Okay, so that's your pump. That's your pump pushing the blood through your body through that hose. Now the bottom number is your diastolic pressure. Now that's when that pumps put all that blood out through your body. Now you have a relaxed state of that pump. That's where that blood pressure is at. So those two numbers are one, the pump pushing, and then the second number is the pump after it's pushed everything out and it's relaxed. And so with these two numbers, we can determine what the flow of blood is through your body. And that actually helps us know kind of, criteria as far as your health. Because as we know,
Right.
high blood pressure leads to a lot of health illnesses.
Tell us what those are.
So unfortunately, high blood pressure, hypertension is a silent killer. And the reason why is a lot of us don't know we have it. And so this is because it attacks the small vessels of your body. Okay, so think about it. We're talking about pressure. So those small vessels of your body that can't really deal with this pressure change, they get, jacked up the worst. And so those are blood vessels like those of your kidneys, right? Because your kidneys are a pretty small organ. The blood vessels going to your kidneys are very small. Your eyes, have very, very, very small blood vessels in them, so you can get affected there. That's called a retinopathy. You can get affected by your heart, and that's when we get problems like heart attacks and things of that nature. And so in your brain, you can get strokes. You have very small blood vessels in your brain. So these are those small vessels that, because of that increased pressure, it's harder for them to adapt and can lead to damage in the surrounding organs or tissue.
Makes perfect sense. So, obviously, if you've been prescribed high blood pressure medicines, you should be taking them daily, whether you feel good or not. Because, like you said, it's called the quote unquote silent killer because oftentimes there are no symptoms of your blood pressure being high. But are there other behaviors other than in addition to taking your medicines, right, that
Yes.
we should be focusing on?
Yes, definitely. And a big one, and I think one that we truly underestimate, is sleep. There have been
Mm,
multiple studies out there that show if you're getting less than 5 hours of sleep on a regular, you are susceptible to getting hypertension. You're also susceptible to getting coronary heart disease. And so I think we
mhm,
really need to focus on our sleep and getting good, productive sleep. We would like to see you get sleep in a range of 7 to 8 hours. I mean, we understand that that's difficult at times, but that's what we want to aim for. We want to stay away from the 4 to 5 hours because there are studies that have been shown that this is not good for us. This can lead to hypertension. This can lead to illness.
mhm.
And so we really need to work on our sleep. Also,
Okay.
of course, the one that everybody knows is, watching our sodium intake.
Mhm,
Salt is, you got to think, salt goes into your blood vessels and it causes fluid to go with it. That increases the pressure. So anything that's really
mhm.
salty is going to increase your blood pressure. So we really want to watch our salt intake.
Okay. Um, and then I know smoking too. Smoking basically is starving your body of oxygen, and so your blood pressure increases because the whole purpose of the blood is to get oxygen to the rest of your body, right?
Yep,
So your
that's
blood
right.
pressure is going to increase to try to pump more of that blood that's not as oxygen rich because you're smoking. So obviously, avoiding smoking is really important. Um, and we always talk about stress too.
Mhm.
What role does stress play in blood pressure?
Stress plays a very big role in blood pressure and the elevation of blood pressure because with stress, you're releasing certain hormones like adrenaline that causes what's called the clamping down of your blood vessels. So think about the hose again. If you clamp down that hose, you're going to increase the pressure through that hose. That pressure is going to lead to an increase of your blood pressure. Stress also it's just a lot of different things that affects all different organs. And so we really want to cut back on our stress. We really want to manage our stress. That's why when you come to my office, I always say, usually people run in there, they're late, and they're like, "Okay, I'm here." I always give them,
Mm,
a couple of minutes to kind of relax because they're
right.
building up that adrenaline. They have those stress hormones going through their body. So of course, their blood pressure is going to be high when they first sit down. So we give them a little bit of time to relax.
Makes sense. And of course, we're chronically under stress. Stressors are always coming our
Like,
way. So for Risa, would love to bring you into the conversation because I know you are a practitioner of transcendental meditation. How does transcendental meditation figure into managing stress?
Absolutely. Thank you. Transcendental meditation. First, let me define what transcendental meditation is.
That's a
It's a
great
very
place to start. Absolutely.
just in case, right, in case anyone doesn't know what it is. Transcendental meditation is a very simple, natural, effortless mental technique. It's practiced every day, twice a day for 20 minutes each sitting. That's 20 minutes in the morning, 20 minutes in the afternoon. And a way I like to understand what it is by comparing it to this analogy of our mind being like the ocean. If you think of the surface level of the ocean, it's very chaotic and hectic, right? It's quite choppy on the surface level of the ocean. However, if you're a scuba diver, you know, as you turn within the ocean, there are quieter levels. The bottom is more quiet, it's more still. Same thing can be said for our mind. We live on this very active surface level, very stressful level where we have a lot of thoughts. I got to do this, I got to do that. I got to make a list. I got to find that list, right? Constantly, our mind is very preoccupied, active on this surface level. However, we have quieter levels of thought and we have that source of where our thinking comes from. So when we say transcendental meditation, what it means is going beyond that active level of thinking to experience quieter levels of thinking. So that naturally what happens as the mind turns within and starts to settle down, we notice the body also starts to settle down. So what transcendental meditation plays in stress is that it's giving the body the opportunity to rest so that it can dissolve that deeply rooted stress and tension that's accumulated. Because we know that stress, although often the stressors we experience are mental, physically, the body is what keeps the score, right? It's one of those great books out there. We experience the social anxiety, we experience constant commuting, microaggressions, right? All of this builds mentally, but the body feels that tension, right? It's affecting our sleep as well. We know stress can affect our sleep. So with the
Sure.
TM technique, I like to, TM is short for transcendental meditation. When you give your mind and body the opportunity to rest, it kicks into play the body's natural ability, which is to heal. As doctors,
Mhm.
I think you will appreciate this analogy. When someone breaks their bone, they go to you, you put it into a cast, right? Automatically, you force the body to rest. It has the intelligence to heal itself. We don't sit there thinking, I got to fix my bone. I got to fix my bone. I got to fix my. No,
Right.
it's horrible inefficient, horrible
Right.
inefficient. Right?
It just does it
Body
automatically.
exactly when given the condition of rest, deep,
Yeah.
fulfilling rest. And that's what
Right.
transcendental meditation provides is that opportunity to rest so that the body can heal itself naturally.
That's an excellent explanation. And there's another analogy I like to use when I talk about stress. I show a picture of people in a roller coaster, and the people in the back, they have their hands up in the air and they're smiling and they're happy and they're having a great time. The people in the middle are like biting their nails. They're terrified. And then there's a guy up front who's like talking on a cell phone. He's like oblivious to what's going on. Like and it underscores the fact that we can have the same experience, the same stressor, but react in different ways. So does transcendental meditation help us be more like the people at the back having a good time, or even the guy up front talking on the cell phone? Does it allow us to also manage the stressors that we have in our life in a from a place of not being, terrified and quote unquote stressed out?
Great question. Absolutely. And the mechanism for transcendental meditation is that it's building resilience. Because we're working at reducing tension and stress that's really been deposited on the nervous system, when we come back into situations that are causing us stress, what we find is they're not as challenging or not as emotionally or physically stressful because we're working at healing that deeply rooted stress. I like to think of this example when we are sleeping well, we have these days we wake up and we feel nothing is going to impact us. We could be stuck in traffic, we could have a negative conversation, but we slept well, so everything's easy going, right? Versus those days when perhaps we didn't sleep well, everything is tension. We go off on a loved one, or we're impatient with one of our clients, or we're impatient even with ourselves. That's because of what stress is doing to the body. So with TM, when we're giving ourselves that ability to release that tension, what we find is we're building more that ability to respond to life instead of feeling like we're always reacting, right? How many times have we
Right.
probably sent a text message? We didn't mean to send something so angrily, but we knew it
Yeah.
was because internally we were stressed. So although I won't say TM will turn everybody into the nonchalant person on
Mhm.
the phone,
On
on
the
the
roller
roller coaster,
coaster. Uh-huh.
right? What we can find is, okay, if I am stressed by something, right? If I do go into fight or flight, now because I'm consistently practicing my meditation, I find that my resilience into something that would have bothered me for the entire day, now I'm only agitated for maybe half a day. Longer
Mm.
practice, 2 hours, more practice, an hour,
Mhm.
even more practice, we find 30 minutes, and then I can let go of this. I
Mhm.
won't be built up with that tension as a result of some stimulant.
Right. So we're talking about, TM as it pertains to stress, but we're talking really, our show is really about blood pressure. So is there a link between, or is there evidence, or there are studies that show that TM can actually influence our blood pressure and our health?
Absolutely, absolutely, and we have, actually 12 published randomized controlled trials that have looked at how transcendental meditation can be added to our routine to help in lowering blood pressure, and we actually had one of these studies was done with the American Heart Association, and
Wow.
they did recommend that TM can be supported as one of the meditation techniques, to really lower high blood pressure. And really, it's related to stress. We've talked about this a few times. If we're reducing stress, then naturally that's one of the risk factors associated with high blood pressure or cardiovascular disease. And when we're reducing that stress, then that's supporting the body's natural ability to dissolve tension and heal itself.
Mhm. Now, you work with individuals who live in communities where there've been lots of trauma. I mentioned that you worked at the Bronx VA, so you have worked with veterans then and now in DC. You
Mhm.
work in an underserved section of the city where there might be more loss, more financial stressors. Um, Explain to us, what is the trauma informed TM technique, and how does it help when you're working with specific populations?
Absolutely. I think it's also helpful, and when we're thinking of what makes something trauma informed, it's that we realize that trauma can impact um, anyone's understanding of how they're going through recovery. Understanding, of course, that trauma has specific symptoms. Perhaps we know it affects sleep. We know it affects our relationships, our interactions. It affects our health. And when we're looking at how transcendental meditation is a trauma informed technique, it's that when we're training folks in this technique and taking them through the program, we're understanding that maybe someone is having a fight or flight response to finally feeling some relaxation, right?
Mhm,
Having not experienced it because we experience so much trauma and being part of a community experiencing toxic levels of stress, you
mhm,
uh, might find it surprising or even jarring to be finally sitting and relaxing. So with TM, we understand that yes, this is a technique that can help to release and reduce that trauma, but we also support people in knowing TM is not going to be a one pill cure all. So we understand that
mhm,
this is one piece of the puzzle that helps with health and wellness and healing. Also knowing how we adjust the curriculum and support folks that perhaps might have a trauma response to feeling more settled. So ideally, 20 minutes twice a day is what we find is the best cocktail, you
mhm.
could say, for them. But we can adjust that training and course based on what's most comfortable for the person learning, or adjust and add in some yoga in addition to their TM technique, because perhaps they
Mhm.
have to work through more physical tension before sitting feels comfortable, or breathing
Right.
technique. We adjust and support what makes it the most comfortable for the individual, and understanding that trauma affects our perception and our ability for wellness practices.
Wow, that sounds like it can really be customized to the individual. But I like what you said, that TM is sort of part of the whole picture. It's not like you're gonna throw out your blood pressure pills and eat potato chips and then meditate for 20 minutes twice a day, right?
I
Right.
wish.
So
No.
yeah. So Dr. Nelson,
Yeah.
how do you, in your practice, when you're approaching somebody with high blood pressure, what are some of the things that you go over with them? And I guess a part of that is stress reduction a part of what you talk about?
Yes, I think you brought up, and this discussion really is bringing to light how stress does apply to the blood pressure and how it elevates the blood pressure and how we really need to focus on alleviating stress in our life. But I also, I like being realistic in my practice, right? I always, sit down and get a whole view and whole perspective of that person's life, because it's easy for me to say, hey, you need to alleviate stress in your life. But then, we have a newborn child in their family. They have, things going on with their mother-in-law or their mother, or just things going on that are stressful. And so I always tell them, first you need to figure out what are the stressors in your life, and then you need to figure out how to manage those stressors in your life. And I think a big thing that we really need to make sure we communicate to all our friends, our family, our communities: therapy helps. Reach out to people, reach out to resources that are there for you. Reach out to a therapist that can sit there, talk to you, and help you work through your problems. Because we do know that stress does have these effects on your health and can lead to severe illness. But I also want to say that, we have to be realistic. And I just always tell people, let's make a timetable. We're not going to solve this overnight, but let's just make sure that we're focused and we do have a goal for ourselves.
Great points. And I guess I would also to add, sometimes people think that alcohol can help reduce stress.
Mhm.
What role does alcohol actually have on blood pressure, Dr. Nelson?
So it's actually the reverse. Alcohol causes an increase in blood pressure. And so,
Mhm.
even though it's a depressant, and just the way it works, it dehydrates you. So once again, it's that pump where, you're pulling blood out of that system. And what your body does to kind of react to that is clamp down a little bit more to kind of equal the flow. And so the more and more you drink, the more and more you're making yourself dehydrated, the more and more you're putting yourself at risk for high blood pressure. And so it's one of those things that, if you're stressed out, now you think that you need to drink more. So you already have the stress factor. Now you have the drinking going on. You're just giving yourself a double whammy. And
Right.
so we really need to be aware of how we're treating ourselves. And self-medication is definitely something that can have a ill effect if it's not handled and approached.
Makes sense. Makes sense. And then, Risa, um, if people want to learn more about TM, what do they do? What can they do?
Absolutely. There's a few avenues in how you can learn transcendental meditation. If you're with us in Washington, D.C., you can email info@themeditationcenterdc.org to learn through our office in Southeast Washington, D.C. Or if you are somewhere across the United States, you can reach out to tm.org to be connected to your local Transcendental Meditation Center.
And are those classes free? Are they do you pay for them? How does it work?
Great question. So, our Washington, D.C. office, the Meditation Center, we're located at the Arc on Mississippi Avenue, 1801 Mississippi Avenue. We do have a grant for all Washingtonians to learn transcendental meditation for free.
Wow.
Awesome.
And if you are based somewhere else in the United States and would like to learn through one of the local transcendental meditation centers, fees are based on one's household income. So there's a sliding fee scale, and your
Hmm.
local TM center can help explain what that fee scale is and whether or not they have partial scholarships available for someone to learn.
Wow. That's great to know. And do you think that doctors will ever write prescriptions for meditation or TM? That's a question
They
for
have
both of you.
I will say, for transcendental meditation, we do have some doctors we work with, and they do write prescriptions for transcendental meditation. Dr.
Okay.
Yolanda over at Children's National, Dr.
Okay.
Teta from, he was at National Defense University, I think, and now is with
Okay.
another hospital, has referred.
All
I
right.
got
All right.
my PhD and get a prescription.
Please do. Join us.
All right, great. Well, you know what? I have a bunch more questions. However, I want to bring in the audience, Via, Wayne, and Bria, who are going to come back and join us, see if they have questions, see what the audience is talking about. What do y'all have? And you're
I had
on
to unmute
mute.
myself.
Go ahead, Bree. we
All
both
right, there we
we
go.
both muted ourselves. Go ahead, Bree.
Yes. So the first question comes from Samantha Johnson, and we talked a little bit earlier about taking blood pressure medication daily, consistently, and she asks, if your blood pressure stays consistently low, do you still have to take your blood pressure medication daily?
Ooh, that's a very good question. Very good question. So ideally, right, when I have a patient and we're talking about blood pressure and I see that it's elevated, my goal is to control it. And so, that may be lifestyle modifications, that may be medication. But in the end, I tell them our pathway is to making sure your blood pressure is controlled. Now, once we get to a controlled blood pressure, now we got some wiggle room and we can also work on seeing if we can make some adjustments. So what it seems like for her is that she may be at that point in her life, maybe she's, done some proper lifestyle modifications where she can work on tapering her blood pressure medication and potentially coming off them. And so you definitely want to do that with your primary care doctor, with your physician. You want to kind of talk to them and, have a step-by-step process. Usually what you're going to do is, decrease the increments of your medication and see where you're at. You want to monitor at home, make sure you have a home blood pressure monitor to do that. I always tell people, and everybody's like, oh, blood pressure monitor, that's expensive, this, that, and the third. I'm like, no, go on Amazon. It doesn't need to talk to you. It doesn't need to follow you around the house. You just need a basic blood pressure machine. You just need basic blood pressure, your top number and a bottom number, and a pulse maybe. And so you just want to make sure that, when you're doing that and you're tapering your blood pressure medications, that you're also checking your blood pressure to ensure that it's not going back up. So that's a very good question.
Yeah, and I
So
just want to underscore what you just said. That's like crucial. If you have a diagnosis of blood pressure, high blood pressure, you should have a blood pressure monitor.
Definitely.
Like the two go together. Because you need to be monitoring it yourself. So, sorry, Bria, you were about to say something.
No. I was going to do a follow-up question. So once you have high blood pressure, you kind of always have high blood pressure as a condition chronically?
Yeah. It's a chronic disease. And so, y'all, it's almost, just like what we talked about with diabetes and things of that nature. Your body has made some changes that you always have to watch. So these are changes that typically are chronic. And so once your blood pressure is controlled, it doesn't mean you don't have, and I'm glad you brought that up because I do have a lot of patients that I'll see them 2 years later, blood pressure skyrocketed. Like, well, my blood pressure was good, so I stopped. But that just means that the medication is working. Now, sometimes some people can come off medications with lifestyle modifications, losing weight, stop drinking, stop smoking, all that stuff. But there's some people that just, have just chronic, problems with blood pressure and are more reliant on having blood pressure medication in their system.
And it could be that those people are making the other lifestyle modifications, but not addressing the stressors and the way they're managing stress, which might be when a stress management technique like TM would also come in handy for those individuals.
Exactly. And I always hate too, it's one that, and it occurs. I mean, after doing a lot of just research with the patient, getting a lot of history, sometimes you're just genetically just predispositioned for high blood pressure. And I've had patients, man, they're cycling 3 times a week. They're vegetarian. They are yoga masters. They, swim, but yet and still they come in and their blood pressure's through the roof. And so unfortunately, some people do just have that genetic predisposition.
Wow. That was one of the questions. One of the questions we have coming from Dave Van Zant is, what role does genes play? If his parents had high blood pressure, is he doomed to it?
So I always say you can't pick your genes, right? And so, unfortunately, it's a map for you, kind of lets you know where you can go. But doesn't mean that you can't, meander and go somewhere else and, see some other sites. So the goal is to focus on everything you can do, and then let it, leave it up to the doctor once you've done that to kind of figure out, what we have to do next and what are some other options.
So I think you do have, if both your parents have high blood pressure, you do have a higher risk of it, but risk doesn't mean it's definitely going to happen.
Right.
You have to
To
watch
what
out.
Dr. Nelson was saying. Yeah.
Hmm.
Because what if both of your parents have hypertension, but they're also obese? So, if you make that choice to lose the weight and you're not, going down that path of obesity, then you may change up what's going on in your path.
Mhm.
All
Okay.
right.
Bree?
Yes, I have a question from John Jameson. How can you manage a healthy sleeping schedule? Do you have any tips for that?
Whew. Listen, if I had tips for that, I'd be a billionaire right now because that is a you know, I joke because I always say adulting, is very hard and difficult because as we try to navigate trying to be successful in our careers, as we navigate trying to be successful parents, sons, family members, community, presence, there's just not enough time in the day. It's just the bottom line. I'm always fighting for that extra 2 hours a day. And so I think it just comes down to really just focusing on and prioritizing your life. For me, I had to tell myself, listen, man, coming home working out is just not working out for me. I have too much going on at home. I have a family. I commit myself to them. So working out in the evening, that's not going to happen. So my compromise is I got to wake up early in the morning, work out. Do I love it? No, I hate it. But that's just a compromise that I have to make, and that's me prioritizing my health.
Okay.
And actually, I want to give Rice an opportunity to answer that as well. How can or does TM help with sleep?
Absolutely. And it does help significantly because, again, we're talking about stress. When we're too stressed right before bed, right, we have every single thing playing through our mind right before we go to sleep. Or we're so tired, we can't fall asleep, right? We think of the babies when they're exhausted and they just can't even fall asleep because they're too tired, right? When the body is not having enough regulation and wellness practices to support that reduction of stress, of course, it will impact our sleep. So other things you can do, maybe meditation is not something you're interested in, but perhaps some yoga, or also turning off our phone 2 hours before going to bed, right? Maybe not scrolling endlessly right before we go to sleep, or taking a walk after you have dinner, right? There's a few things we can do, even if we don't like meditation or the idea of meditation, to at least improve our sleep hygiene. Routines
Right.
are really helpful too, right? If you're training your body to follow a certain routine right before bed, you can find that
Mhm.
can help sleep.
Wow.
Right.
Great. I have a question from Tracy Walls, but I wanna since she is a vet, I want to get to a second question, but her first question is, what advice do you have for people with white coat syndrome? My pressure is reasonable when I take it at home. However, in the doctor's office, it
Mm.
skyrockets.
Mm. Yeah, that's one of those very common, but we have a plan for that, right? So white coat syndrome just means, just to let everybody know, when you come, you're fine at home, you're taking blood pressure. Like, man, I'm going to my doctor's office today. I'm gonna show him his blood pressure. He's gonna just be happy and excited. And you walk in there, you sit down, your blood pressure's high. And
Mm.
so typically what happens is it's just that stress response. Your adrenaline's flowing and you're ramped up. You're seeing your doctor. And so for the most part, we do not worry about white coat syndrome because for me seeing you, that's a window of time, a very short window of time. What I'm more concerned about is what's going on at home and throughout the rest of your day. So if I have my patient taking their blood pressure throughout the day, they come in with their readings. They're like, look, these are my readings at home. This is what's going on. I really say, listen, thank you for bringing that in, first and foremost, for being a good patient. And second of all, don't worry, this blood pressure you have here is just a reaction for you being in this clinic, and it's not reflective of just your state, your natural state of your body.
Okay. So the second question, because seeing Tracy, she is a friend of the show and a veteran. Uh, I
Thank you,
wanted
sir.
to. We had talked earlier with you guys. We had talked off camera about TM with veterans. Can you go, Risa, and explain your work with veterans?
Absolutely. Yes. We've done extensive work with veterans and looking at how practicing transcendental meditation consistently can see reduction in PTSD symptoms. So, those are related to stress, anxiety, depression, suicidality. We've also looked at this in our first responder community as well, and seen that transcendental meditation can support the reduction of those symptoms related to PTSD with that consistent practice. Another big issue for veterans is also sleep disturbance, and we have seen reductions in sleep disturbance. And what does that look and feel like? That looks and feels like that perhaps I'm falling asleep more easily, or when my sleep is disturbed, I can fall back asleep more easily. Or if I have to get up in the middle of the night, I'm finding I'm not staying up for hours on end, or waking up and actually feeling rested as a result of consistent practice with TM. And consistent practice of TM is that daily practice, and I like to say an average of about 3 months. We see these types of benefits. Some folks see it a little bit sooner, but I see 3 months. Like you would any kind of clinical trial for any medical drug, I'd say the same thing for your meditation practice is consistency key.
Excellent. That's excellent information. And since we're talking so much about sleep, I just want to throw in that if you're having problems sleeping or you're waking up in the morning and you're feeling like you're not rested, or you have a new diagnosis of high blood pressure, or you snore, your partner tells you snore, you need to get tested for sleep apnea, because sleep apnea, meaning you're not getting enough air into your body when you're asleep, also leads to high blood pressure. So if you have a new diagnosis or a diagnosis of high blood pressure, you've never been evaluated for that, think about talking with your doctor about being evaluated for sleep apnea.
Great point.
All righty. This is related, kind of not related. This is a question from Mia Williams. And this is for Risa. How did you come to find TM? What's the training like?
My TM story is a very long one, but short. I will say very briefly, I went to New York City for grad school to study at NYU. I wanted to see how to use school-based interventions to help students of color succeed. The very first school I went on assignment to ended up being a transcendental meditation school with the David Lynch Foundation. I got to learn on a scholarship, and it personally changed my life and the life of the kids I was working with. So I decided to make this my career. And when we talk about what the training looks like, transcendental meditation can be learned via 2 avenues. One is a fully in-person course where you would come in person to your center for 4 consecutive days, 75 minutes each day. So an hour and 15 minutes. If you started on Monday, you'd come back Tuesday, Wednesday, and Thursday. The other option, if you're feeling that coming consecutively in person would not be the most comfortable for your schedule, would be our 90% virtual course option, where the very first day you come in person for 75 minutes, and then the following 3 days you complete course content online via an app. And your TM center can talk you through both options to see what would work best for you.
Wow.
Wonderful. That was a great question. I'm glad we got to hear that background. That's pretty neat.
All right. We have a question from Shanita Brown. Do you often recommend massage treatments with meditation?
I would say depends on the form of meditation you're doing. When we think of transcendental meditation, you can absolutely have your massage and your TM practice would be separate. When we hear the word meditation, meditation means to think deeply. There are so many forms of meditation out there. It's about figuring out which one works best for you, right? I love transcendental meditation. Of course, I will share it, but also I recognize it may not be for everyone. So figuring out which meditation practice is most helpful, and you can find how that combines or doesn't combine with a massage therapy. I would say it's definitely a great supplement to have because that's physically working out the tension that has been built in the physiology. TM would be supplemental to that.
Oh, wow.
Right.
Fantastic.
I think one of the points here, as Dr. Nelson had said, is we're talking kind of like about stress management, especially as it relates to blood pressure. And everybody's going to have their particular road to what they find helps them to de-stress and manage the stressors in their life. For some people, it's going to be massage, right? Combined. For some people, it might be massage combined with meditation. For other people, it might be, playing their guitar. So it all depends on what does it for you. But I think it's important to know that transcendental meditation, as one of the forms of meditation, has evidence behind it in terms of being a way that helps to decrease blood pressure.
Definitely.
Okay. And there we have it. Dr. Mel,
All
you got any
right.
more questions?
No, I think this was wonderful. Y'all were just
Yes.
full of fantastic information. Thank you so much, Dr. Sydney Nelson. Thank you so much, Raisa Martinez, for joining us and sharing all these great facts with us. These are what I call life hacks for dealing with high blood pressure. Of course, thank you so much to Bria and Wayne for bringing the questions from the audience. Great questions. Thank you so much for putting everything into the chat and being a part of our discussion tonight. And as always, I have to remind everybody that study is still going on. You can still get in on it. And if you've gotten in on it, you should be sharing it with other people to let them know that they can participate in the COVID resilience research study at Howard University. So if, just so that you know, it's how you've coped during the pandemic, whether you had COVID or not, doesn't matter. You fill out 2 surveys. That's it. 2 surveys, and you can be reimbursed $100. If you have any interest whatsoever, please reach out to Dana Harvey. And the way to reach her is danaharveyresearch@gmail.com. That's Dana, D-A-N-A, Harvey, H-A-R-V-E-Y, research, all one word, @gmail.com. Well, that is it for us. This has been a fantastic show. I hope everybody got something out of it. I hope you shared it with everybody who you know who might benefit from understanding more about high blood pressure and how to manage it. Until I see you all next week, please remember to be wise, to be well, and to be health empowered. Thanks so much for joining us.
I should thank the Rock. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now, his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.